accessibility was an issue. It's very different being on the patient side, and I got to see firsthand what it's like. I do have a passion for patients and the care that they receive and how it's received.
Welcome to Revenue Cycle Above the Bottom Line, the podcast where we dive deep into the world of revenue cycle management. I'm your host, Tim Reiner, and in each episode, we sit down with industry leaders, innovators, and experts to explore challenges and strategies shaping the future of healthcare revenue cycle. Whether you're a seasoned professional or just starting out in the field, this podcast is your space for thought-provoking conversations, actionable career learnings, and discussions about the latest trends you need to know about. Thanks for tuning in, and let's get started. Today, I'm joined by Carla Graves, Vice President of Ambulatory Revenue Cycle at AdventHealth. Carla has over 27 years of experience in revenue cycle and a passion for building relationships that lead to optimizing workflow for all. Carla, thanks so much for being with us today.
Thanks for having me, Tim.
Before we jump into your current role, tell me a little bit more about your role at AdventHealth today and the areas you have responsibility for.
So currently, I am responsible for all revenue cycle for physician enterprise, including ambulatory.
You have a long history of revenue cycle experience. Tell me how you kind of got started in rev cycle.
I started in rev cycle. I actually started in operations, so managing physician practices, and then after managing physician practices, I started managing larger physician practices that were private practice. Private practice is a whole nother entity because you're really responsible for the financial stability of the operation.
Of a small business.
Right. It is definitely a small business. So I used to joke and say I managed the checkbook because you had to be responsible for revenue cycle. You had to be responsible for clinical operations and, everything that makes a physician organization run. And so I really felt a passion for revenue cycle because I realized that it did not matter how much my providers did if we were not collecting on the back end.
You had a personal challenge that had a significant impact on your career.
I did.
Tell us a little bit about that.
My first husband passed away from multiple myeloma cancer, and that left me as a single parent. During that time, I strived to show my children that what happens to you does not necessarily define you, and that bad things are going to happen in life, but we have to keep going. And part of the keep going for me was going back to school and getting my master's degree and expanding my career in rev cycle. Started off, I wanted to do more consulting, and being a single parent, you can't really do consulting and doing the travel. So I did more operational positions.
How did that kind of inform some of the ways that you think about healthcare or rev cycle in general?
Very different. Accessibility was an issue. It's very different being on the patient side, and I got to see firsthand what it's like. I do have a passion for patients and the care that they receive and how it's received.
Yeah, that patient navigation,
yes.
And that journey is so important. So did you have an early mentor in your career?
I did.
Okay.
I did. Her name was Deborah Hill.
Okay.
I actually worked with her at Northeast Georgia Medical Center, and we were both practice managers. And she left operations and went into consulting.
Okay.
So that's kind of tried to follow her and follow her path. It did not work out for me for personal reasons that I just shared, but she was instrumental in showing me all things operations. I started when I was 20. So I was very new to operations, very new to leadership. She gave me advice. She mentored me. She helped navigate my path and gave recommendations on which groups I should join as it relates to professional organizations such as AAPC and MGMA. She introduced me to all things healthcare. So I truly appreciate her and her guidance.
Is there a particular saying or any particular specific learning that you kind of even reflect back on today from her mentorship?
Never stop learning.
Okay.
And that was her thing back then, and I still feel the same way. I continue to learn. I continue to grow. I never want to reach to a point where I feel like I know everything or I feel like I've gained everything that I need to know. I always want to keep growing, and I did get that from her.
So you describe yourself with 3 Ds: dedicated, determined, and dependable.
Yes.
So how do those traits kind of inform your leadership brand or your leadership philosophy?
As it relates to my leadership and the way that I hold myself in the workplace, I always want to be viewed as a dedicated employee, a determined employee, and dependable.
You told me a story when we were just kind of chatting before about maybe some of that determination. So you were telling me you read a book by FDR. Tell me the little story that you took from that autobiography.
Yeah. So one of the major quotes that I took from that book was Franklin D. Roosevelt said, "If you're at the end of your rope, tie a knot and hold on." And I have tried to hold on to that my entire life, because there will be times in life where you will feel like you're at the end of your rope, but you have to tie a knot and hold on and just keep going.
So let's transition a bit more about your current role and the challenges you face. What are some of the biggest challenges in the professional revenue cycle, whether it be kind of charge capture, billing, collections, that sort of thing?
Some of the biggest challenges that we have is just staying on top of all of the regulatory changes.
Just the way in which the reimbursement continues to be throttled down for physician groups.
I agree. Providers are working harder and seeing less and less reimbursement. So I think that poses a challenge in itself.
Yeah.
As it relates to, managed care plans, commercial payers.
Is it just about like making sure people know what they owe, or are there some other strategies that we can employ?
I think informing patients of what they know is first. So communication is key. Informing patients of what their financial responsibility is should be number one. And then talking with them to determine how are we going to collect that balance. Is it charity? We have, financial options. Is it a payment plan? So discussing your financial options up front is absolutely the most important thing to do as it relates to time of service collections.
What strategies have you found to be effective for reducing denials? That's another of the key pressures besides like regulatory or patient-oriented. So what can we do with denials?
Denials are tricky.
Yeah.
So with denials, I think we have to use the data that is provided.
Yeah.
So there are root causes that come with each denial. I think categorizing those denials and determining, is it a payer issue? Yeah. Is it a provider issue? Is this related to a diagnosis? Is it things that we need to change within our coding workflow?
Yeah.
Are we missing things in the documentation?
Right.
So just diving into the data as it relates to denials will help you determine which step to take.
So what are some of the other trends in revenue cycle that you find kind of exciting or in some ways kind of concerning?
AI could be a great tool for revenue cycle optimization. I think it can also be scary if it's utilized in the wrong way, in the wrong places.
What role does that technology play for maybe the good of the professional revenue cycle? Like what benefits can it bring us?
I think the best benefit it can bring us is efficiency. Efficiency, as we, on the professional side, we have a ton of claims that go out. Yeah. And so to have one person touch all of those claims is highly ineffective and inefficient. So AI is a tool that we could utilize to touch multiple claims in mass and still get the work done. Pre-registration denials are high. So I think we do have a claim scrubber. It goes out and looks for coverage discovery. One of the ways that AI can assist with that is not only looking for the correct insurance, but also pulling in that insurance information and plugging it into the system.
Yeah.
And so that's where we can use AI. I think that's important. We've got the front desk team members who they are busy answering the phones. They are busy with patients in front of them. They are so busy just trying to maintain a pleasant atmosphere for the patient and give that patient a good patient experience that sometimes things go amiss.
Yeah.
And AI could help us in that area.
Before we continue, we wanted to thank you for tuning in. If you have questions or thoughts or just want to say hi, we'd love to hear from you. Send us an email at revcyclepodcast@adventhealth.com. That is REVCYCLE podcast@adventhealth.com. If you enjoyed this episode so far, be sure to like, subscribe, or follow so you never miss a new episode release. Now, let's get back to the rest of the episode. You have a lot of experience in obtaining kind of some physician-oriented coding certifications.
Mm-hmm.
Would you counsel people going through RevCycle career ladders to kind of seek those sort of certificates on their career path?
I would.
Yeah.
So I can tell you 20 years ago, coding certificates looked a little different than what they do now. So
okay.
Right now, there's a ton of them out there.
Yeah.
And so there's always some group that's pushing for you to get a certification. I would say that coding certificates are absolutely phenomenal to have. It gives you the background to work in revenue cycle.
Yeah.
I have the knowledge to seek some of those coding denials out versus running to coding and saying, why was this built this way?
Yeah.
So I think that's important as a leader to understand why things occur. You don't always have to have a coding certificate to do that, but you have to have the knowledge.
Because like you say, you can't understand the pattern of a denial, which is oftentimes like either these combinations of things are allowed or they're not.
Right.
You can't understand those relationships unless you kind of understand the coding element. So maybe you don't have to be a coder, but you got to understand the terminology.
And that's what I would recommend. Even if you don't get the certificate, if you don't take the exam, take the course.
Yeah.
Learn the material so that you are more knowledgeable in that area. I mean, it only helps you out. It helps your team out.
Yeah. So how do you approach other training within kind of team member development to ensure a high-performing revenue cycle? So coding is one aspect, but what are some other things we can do to have an excellently trained revenue cycle team?
So I think we have to do specific need training.
Yeah.
Each person has their own set of individual needs. And so the way I try to approach my team is learning what their needs are and making sure that they have all the tools necessary for success. If it's leadership training, sometimes you'll have the person who has all of the appropriate skills necessary, but they need some leadership training.
Right.
Sometimes it is the coding experience that they need. Sometimes it's just collaboration experience. So I think you have to be kind of specific to what your team needs. There has to be a standard, of course, that you say every team member, I want them to at least have this much knowledge. But as it relates to, bringing your team up and making sure that they can provide the things that you need for them to provide, some of those are probably going to be more specific to that team member.
So let's pivot to technology really quick. If you could just like wave your magic wand and have one thing change about the revenue cycle industry, what would that be?
I would say consistency in denials management reporting from the payers.
And reporting, okay.
Yeah.
Meaning like the way that they're reporting the remittance codes, or at what level of detail?
Yes, the way that they report the remittance codes. On the physician side, on the professional side, we do see some inconsistency between payers and how they respond to different denials. In some instances, they'll say it's an authorization denial when it's not. It's a registration denial. And it leaves your team just chasing things that really they shouldn't have had to go that far down the road. So if it was an authorization denial because, there's no auth on file, it doesn't require an auth. I've seen that before.
Yeah.
It's really just the payer saying this is the code that we've lumped in, and they use AI for those denial reporting tools. So if there was some consistency there, I think that would make life a lot easier.
Otherwise, you'd have your claim system avoid all these items, right? And so, I think that is one of the crazy things about our industry is we have all this undocumented rules. There's rules, it's in the payer system, but it's not transparent to providers. And so, hopefully there's things that a language model can determine from the experience and data stream that we provided. What's your vision for the future of the AdventHealth physician revenue cycle in the next 3 to 5 years, 10 years?
I would say I would love to have a frictionless revenue cycle,
okay. All right.
Which means we are constantly enhancing automation.
Okay.
I've got a team that is growing in knowledge, and we are introducing more automation.
What do you think is maybe the biggest challenge to implementing automation? Is it kind of self-imposed, or is it more a technology issue?
Some of it is self-imposed, I think. Some of the technology we do need to test out to make sure that it doesn't break something else, because oftentimes we will have good intention and implement a tool that is supposed to enhance one area, but we didn't take into consideration that it could break something else. So detailed testing is key as well.
So, internally we're on a journey to move from a world-class revenue cycle to preeminent revenue cycle, and to be a preeminent faith-based consumer-focused health organization. What does that mean from your perspective? And what does that mean for you to kind of get your team to contribute to that?
I will tell you, when I first saw the preeminent faith-based as the goal, I really smiled because to me, what that says is that Advent is on the path of becoming a organization that is rooted in faith, that is striving for excellence. Not only just excellence in business model, but excellence in how they treat their patients as well as their employees. So for me, for my team to get to a point where we are at that preeminent state, we have to continue to grow. We have to be open to change. We don't want to be like Blockbuster. We have to be open to new ideas and new things. And so then and only then I feel like we can get to a preeminent state.
Is there one thing you would want the audience to kind of take away from our conversation?
Be resilient. In revenue cycle and in healthcare, it is always changing. And so in order to get to the next level, you have to be resilient. You have to keep learning. You have to keep growing and moving forward.
We had our previous guest, kind of as we wrap up here, give you a question. And so their question for you is, they want you to share your favorite childhood memory and one that makes it sort of a lasting impact on you.
I would say my favorite childhood memory was having a conversation with my grandfather.
Okay.
He was 95 when he passed away.
All right.
And he was in the military. He was in the Navy. And one of the things that he did, I think he quit school when he was 12 or 13. And he did that so that he could help provide food for his home. His father had passed away and his mother was not able to work. And so he had a deep appreciation. He loved school. So he had a deep appreciation for education. So one of the things that he told me then, as well as my mentor that I mentioned earlier, is to learn as much as you can and keep learning, keep growing, and never stop learning. Never be afraid to learn more.
Carla, thank you so much for joining us today. I've really enjoyed our conversation.
Thank you for having me, Tim. I've enjoyed it as well.
Thanks so much for tuning into today's episode. Make sure to like and subscribe to our channel.